Hi, good morning. I'm Janet Silvero, President of the Montego Bay Chamber of Commerce and Industry. Managing occupational health and safety risk amid the reopening of Jamaica's economy is what we're going to be discussing with you this morning. We want to welcome all those who are on YouTube watching us. Our mission really is critical in the absence of legislation, which would guide stakeholders on how to treat with the workplace response in relation to biological and psychological hazard, which is COVID-19. Our aim this morning is to provide guidance, which will help you as business operators to enhance your capacity. In the absence of legislation and regulation, there are certain organizations that would be more in tune, because generally we're not in tune. We're not sensitive to the risk attached to operating in a business environment. Before COVID-19, we were caught flat-footed, but the response from Jamaica's public health team is commendable. But experts will also tell you that this was a knee-jerk reaction and we need the proper tools to ensure what has happened to us now does not necessarily happen to us the same way the next time around. We must become a nation of people who practice preventative measures instead of being reactive as it relates to occupational safety. With us this morning, as we commence on a series of webinars in partnership with Dunncox, attorneys at law, and the University of the West Indies Western Jamaica campus, is cadre of folks, an attorney at law, who has spent most of her professional life at the public bar, where she developed a passion for labor and employment law practice and policy. At the pinnacle of her career in the public service, she was senior legal officer to the Ministry of Labor and Social Security, where she was instrumental in advancing the process for revisions to several labor laws, as well as laying the groundwork for her niche practice area, occupational safety and health law. So you see, what we have brought to you this morning is an expert at the subject matter. In 2015, Ms. Folks was awarded Master of Labor Law and Relations by the University of Sydney Law School in Australia. She prides herself as a social justice advocate and is especially passionate about initiatives geared at empowering women and girls. At present, Ms. Folks is a sole practitioner operating from a partly virtual civil law practice, a past president of the Rotary Club of Ligonier Plains, and a former member of the executive committee of the Jamaica Civil Service Association. She currently serves on the Employment Law Subcommittee, as well as the Publications and Law Reporting Subcommittee of the Jamaica Bar Association. We want to thank her for agreeing to partnering with Dunncox in delivering this webinar this morning. We also want to thank those who worked behind the scene to ensure that this happened. Directors Paulette Neal and Mary Chambers and Karen Benjamin, in addition to two vice presidents of the Montego Bay Chamber of Commerce and Industry, Carleen May and Damia Monthrope. And the man behind the scenes who is ensuring that everything happens the way it should this morning is no other than Andre Hewitt, who is the MIT person at UWI Mona in Kingston. Dr. Patrick Prendergast, who is UWI Mona Western Jamaica campus, has been very instrumental in getting us here. In addition to Dunncox, Jonathan Morgan, one of the partners there, who has been working with us on this project. We know you have been waiting to hear what we have to say, so we now introduce you Miss Kadria Folks, who will deliver this webinar. Thank you.
Good morning, and thank you, Madam President, for that introduction. Thank you also to those who are joining us, colleagues, friends. Thank you also to Dunncox for having organized this activity, and to the Montego Bay Chamber of Commerce and UA Western Jamaica campus. So this morning, we're going to be looking at managing occupational safety and health risks amidst the reopening of Jamaica's economy. I'm going to be sharing screen. All right. So that screen right there is really my attempt at an icebreaker, and also to ask you kindly to focus on what it is that you hope to get from this exercise. Hopefully at the end of this exercise, you'll realize that this gentleman needs to learn a lot more, and that you too would have learned something, taken away something from this exercise, and perhaps be inspired to be more conscious of safety and health at your workplace. By way of introduction, just to set the situational context, I know you have heard a lot about the medical background of coronavirus, but I have to start somewhere. So the coronavirus is indeed novel. It's a virus, it's a pathogen, it's an enemy that we can't see. And even though we don't know where it came from, some persons say it's a lab, animals, otherwise, we know that geographically it started in Wuhan, in China. And that in January, this side of the world started to be very concerned about it. And on the 10th of January, we had our first case here in Jamaica. On the 11th, a pandemic was declared by the WHO. And that, of course, means that it's of global concern. So no country has been spared in terms of the onslaught of this virus. The transmission of the virus itself, we all also know that based on the public health interventions, when a person sneezes, they release droplets, which contaminate surfaces. And if you are in contact with those surfaces as a healthy person, then you also can contract that virus. And of course, the reference to that will be the workplace protocols from the Ministry of Health and Wellness, which has been doing very well at their public health campaign at informing us about the nature of this virus. So as I mentioned before, the virus is indeed novel. Nobody knows where it came from, and there's no pharmaceutical interventions. So the global focus has really been on mitigation strategies. And it's quite interesting because the survival of the human race now comes down to how committed we are to washing our hands and wearing masks and keeping away from each other, essentially. And so in the workplace, there was a marked upheaval, I should say, in terms of the impact of COVID-19, because we hear all of these things. A lot of people didn't know what to expect, you know, and certainly in Jamaica, where in terms of safety and health, we're stronger on the safety side. So we see something, we know it's a hazard, and then we will take some steps. But here it is that there's this hazard that we're not able to see. And so in terms of managing it, we needed to look to the government response to see exactly how it is that we can treat with this issue. And so in the world of work, the response in order to remain a going concern was really to lay off persons, make persons redundant, or make positions redundant rather. And that created a lot of unrest, you know, the persons were unsettled. There was a lot of stress and anxiety. And then the signal workplace response of working from home, teleworking, also caused some anxiety, because a lot of persons are used to getting up, dressing up, and going to work and benefited from the social interactions. And then you're told that, oh, you have to now work from home because you have to ensure that you're not exposed to this virus. And then also there are persons who can't avoid coming into, to interact on some level with the virus in terms of or frontline workers or healthcare workers. And then there was the issue with the workplace cluster, where in one workplace, a lot of persons became infected, and with that, the genesis of the community spread of the virus. So that is the context in which we are operating, where COVID-19 is concerned and why it is a concern for the world of work in Jamaica. So up until the end of May, the focus has been on physical distancing. And so the directive in keeping with that was to turn a yard. But towards the end of May and early June, the narrative changed when we realized that the coronavirus is pretty much here to stay and that we need to learn to coexist safely with the coronavirus. And so the narrative then shifted to work safe, work smart. And so more persons are now back out at work, better informed as to how it is that they need to protect themselves and safeguard against infection. Now, in terms of returning to work, it's not business as usual. The normal is changed, and so we have to ensure that we are equipped with the requisite skills, tools, knowledge, so that we can react appropriately. From the International Labour Organization, which is the standard setting body of the United Nations in terms of labor and employment policy, they have given us 3 nuggets which should guide our policy interventions for reactivating our economies. The first is that any plan to resume work requires cooperation and coordinated action among the labor tripartite. Now, the labor tripartite is comprised of government, worker or their representatives, and business interests, employers. And so these 3 parties need to come together and look at the issue and then work out the way forward. Also, we must take a human-centered approach and the impacts on life and health, as well as the anticipation and mitigation of risk. So at the center of this is it's very important to ensure that businesses remain profitable. But at the end of the day, we're balancing the scales between life and livelihoods, and I like to put in it profit, because at the end of the day, business is about making money. So the ILO is saying, yes, it's about making money, but see if everybody can win and workers can be spared the onset of this virus and you can still remain viable. Also, any intervention must be informed by principles of decent work, which are fundamental. And during the presentation, I will go some more into what this decent work entails. So I'm going to be starting out by framing the discussion by looking at the legal space in which we are operating. So I'm going to be first looking at what obtains legally in Jamaica in terms of the existing body of laws. Then we're going to take an international approach to COVID-19 to see what normative behaviors we can model. Then we're going to be looking at some practical guidance. What can you do practically to guard against the spread of COVID-19 in your workplaces? And for that purpose, we're going to be looking at the risk management process. Then we're also going to be looking at future-proofing Jamaican workplaces in terms of safety and health. And so we're going to be looking at what is projected for the future. So we didn't have enough guidance in the workplace, directly from the workplace. The public health response was very strong and very useful and very relevant. But the workplace has a role to play. And so we're going to be looking at some of the things that we could have done differently. And then we look at the age-old issue of this contention between labor and capital, and probably look to see why it is that the relevant legislation has not been passed as yet. And so we can do some introspection and see how it is that we can contribute to the effort. All right, so we're going to start with the common law, which is judge-made law, case law. We inherited that law. And the statement of the law in terms of keeping a worker safe on the part of an employer is that the employer has a duty to take reasonable care for the safety of employees. What does that duty entail? Well, it entails providing a competent staff of men, and by men it really means workers. The law wasn't so gender neutral back then. Adequate plant and equipment, a safe system of work with effective supervision, and a safe place of work. And so readily we can see where, in terms of the common law obligations, at least two of those headings will jump out at us in terms of what the duty entails, and that's a safe place of work and a safe system of work. So there is the basis for that obligation in Jamaica, even without a legislation. However, the common law is not without difficulty because it doesn't drill down and give you that guidance as to how do you attain these ideals. And also, sometimes the principles are in conflict. So for instance, I'm looking at two cases from Commonwealth jurisdictions where the approach of the courts is inconsistent and probably you might say not very helpful. So for instance, in Johnstone, which is from the English Court of Appeal, the express term of a doctor's employment contract entitled the hospital to roster him on very long shifts. And the court was of the view that this must be interpreted in the context of the overarching duty to take reasonable care to not subject employees to unnecessary risk of harm. So the conventional wisdom is that, for instance, a worker is not really supposed to be working for more than 12 hours per day. But then this doctor was on call all the time and he got ill as a result. And the court said, well, you know, even though contractually you're allowed to have him on call and roster him whenever, technically, but really and truly you have to juxtapose that with your duty of care to take reasonable care for his safety. But then contrast that to another decision coming out of the English Commonwealth, where an employee could not recover compensation after having suffered a stress-related psychiatric illness on account of being overworked. The court was of the view that the employer's duty of care to the employee is to be considered in light of their respective contractual duties. So here it is that the same law, but the court is saying that in this case, it is the contract and what the person agreed to do that takes precedence over the duty to take reasonable care. So we see where there are inconsistencies, and neither is helpful to an employer because an employer has a vested interest in the health and welfare of his worker. Hence the need for legislative intervention. So it will be clear exactly the parameters within which we are working. And if you're to contrast that with the provisions under the proposed legislation, it clearly states that health is a concern in terms of considering the safety and health obligation of the employer to the worker. It is obvious, it is clearly stated that health is a relevant consideration and is defined as meaning physical, mental, and social well-being. So health in terms of the physical integrity, which is what we're used to dealing with when it comes to occupational safety, which as I mentioned prior is more what we're in tune with, but also the things that you can't see, but still impacts on the worker as a result of how work is organized and their work experience. All right, so from statute in Jamaica, we have the Factories Act, which is the main legislation dealing with occupational safety. Well, the difficulty with the Factories Act, first and foremost, is that it only applies if you work in a factory or if you work, it has regulations that treat it with dock work and work in the construction industry. So if you're in none of those industries, then you're not covered. And I dare say most of us are not working in those industries. So what about us? Also, it's limited to work in an employment relationship. So you must have an employer-employee relationship. But these days, the world of work is populated with far more different typologies than that. A lot of persons who work and go to work every day, they are not classified as employees, they are classified as something else. But what about them? Is it that it's okay to put them in unsafe conditions? And so the short answer to that is no. So we're now going to be looking at what the international body of law has to say. Now, just to point out a few things about the international body of law. In Jamaica, we have a dualist legal tradition. And what that means is that the international law becomes part of our law when we enact legislation and then we ratify the standard, right? So if it is that the standard is not in legislation, then technically we're not guided by it. However, the better view is that international law is important in filling gaps in our legal framework. So to the extent that there's an issue in the workplace and there's no legislation that addresses directly how it is that we're to respond and what is to guide action, then we are able to look to the body of international laws to see what is normative, what is established as best practice. And so we're grateful for these standards which have informed the protocols, because if you are to measure the protocols coming out of the Ministry of Health and Wellness against the background of these international labor standards, you'll realize the consistency. All right, so I mentioned that I will come back to this whole issue of decent work. So the objective of the international labor standards in this regard is to ensure that workers experience decent work, which refers to employment that respects the fundamental rights of the human person, as well as the rights of workers in terms of conditions of work, remuneration, respect for the physical and mental integrity of the worker in the exercise of his or her employment. And this is just going back to that age-old issue of labor not being a commodity. So the worker in the workplace setting is not a machine. You don't just program them and they go, 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 go. Right? These are people, and they have limitations. And so pretty much these standards are requiring employers to always be mindful of that. It's one thing to get the job done, but it cannot be done at the expense of the worker's health. And so decent work has to be work that is safe. And the genesis of the concept is the International Covenant on Economic, Social, and Cultural Rights. So the ILO's decent work agenda, and we're looking at this because remember from the outset, we established that the ILO says that any return to work strategy must be cognizant of decent work principles. So there are 4 pillars to the decent work agenda, which is advanced by the International Labour Organization. The first is fundamental principles and rights at work, which we're going to look at in a little more depth in terms of the conventions, recommendations, and protocols of the ILO that are relevant to treating with safety and health at the workplace. Also, employment creation and enterprise development, social protection. There was a lot of discussion about that recently in terms of the interventions where COVID-19 has displaced workers. So, you know, in terms of income supplements, so to speak. Also social dialogue. So social dialogue is really about engaging all the workplace parties when it comes to addressing issues. So everyone's perspective and interest brings to bear on the solution that is arrived at. So what is occupational safety and health? Occupational safety and health is relatively new to the Jamaican regulatory space. So we're going to start by looking at what it is that we're going to be doing different, you know, what is it that we're not doing that we really need to be doing? And it starts with an understanding of what occupational safety and health is. It is an interdisciplinary science which is concerned with the anticipation, recognition, evaluation, and control of hazards arising in or from the workplace that could impair the health and well-being of workers, taking into account the possible impact on the surrounding community and general environment. And it's interdisciplinary because there's interactions with a lot of scientific areas. Occupational medicine is a thing, public health, obviously, industrial engineering, ergonomics, chemistry, psychology, and they didn't mention law, but we can just read that in there. So the International Labour Standards on Occupational Safety and Health. Remember, when we were looking at decent work and the 4 pillars, the first one we mentioned was principles, standards and principles at work, fundamental principles and rights at work. So the standards treat with general provisions on safety and health, which is what we're gonna be looking at. But you have others that look at, they have an occupational-based focus. So they're looking at safety and health in specific occupation, like docks and agriculture. Some of them have a hazard-based focus. So you might have one dealing with noise pollution, air pollution, asbestos, hazards associated with specific economic activities. For instance, Convention 189 on decent work for domestic workers, even though it's looking at the full gamut of work experience for domestic workers, it also has a safety and health component. And of course, they have workmen's compensation. So the main convention on occupational safety and health, Convention 155. And I've taken out some of the provisions for the purposes of our discussion. So it says that employers must ensure, so far as is reasonable practicable, that the workplace, machinery, equipment, and work processes under their control are safe and without risk to health. And of course, the issue is not about avoiding work accidents and outbreaks of diseases, but also taking proactive action to identify hazards, assess the risk, and implement adequate control. And much of the next aspect of my presentation is going to be focusing on this risk management. It also says that employers are to provide adequate personal protective equipment or PPE without cost to the workers. And that is very important, because if it's going to cost the workers, then you're going to find that workers might opt out of wearing the personal protective equipment. And so you want to ensure safety, and the only way to ensure is to ensure that it's in a context in which they will have it. And so the obligation is on the employer to fulfill that requirement. Also says that workers are to be afforded a right to refuse work, which they have reasonable justification to believe presents an imminent and serious danger to their life or health. And I just want to pause to compare that with what obtains now. No worker in Jamaica has this right as of now. And that is because at common law, there's what you call a work wage bargain. Essentially, it means that if you don't work, you don't get paid. That's a common law. And so you will need a legislation that will justify a situation in which you can refuse to work and still legitimately expect to be paid. And so under the proposed legislation, that is one of the far-reaching provisions that we will have to contend with. The protocol, and just to mention that conventions and protocols are ratifiable instruments, but then when we look at the recommendations, those are just for guidance to give content to the conventions and protocols. And so the protocol of 2002 to the OSH Convention encourages members to establish systems for recording and notification in respect to occupational accidents and diseases, dangerous occurrences, and commuting accidents. Recording is important for several reasons, but one of the reasons that comes to me readily, which an employer can, to my mind, readily appreciate is, for instance, some hazards have a long, what should I call it? Well, it's called latency period. So a worker might be exposed to a hazard today and they're not affected until years down the road, like asbestos. So if as an employer, you're keeping record of exposure, time, and level, and all of that, and you know that, for instance, your records don't indicate that there was any kind of asbestos exposure in respect of that particular worker, then years later when a related cancer or other illness manifests, then you will be able to defend yourself. But outside of that, recording serves other purposes. The definition of an occupational disease covers any disease contracted as a result of an exposure to risk factors arising from work activity. And all of this is contained in proposed legislation. And just to mention, in terms of occupational accidents, the legislation also speaks to commuting accidents, which is a part of safety and health that we have not really, dealt with adequately, because some of the road traffic accidents that happen, some of them are actually work accidents. People are working too long on the job and tired, so you're leaving work and going home and you're meeting an accident. It's not just a road traffic accident, it's an occupational accident. And when we appreciate it as that, it means therefore that the appropriate intervention can be done, not just a matter of the road traffic interventions and safety on the roads, but also from the workspace where an employer can be made aware that, listen, maybe the workers are working too long and they need to take breaks, that kind of thing. There's the Occupational Health Services Convention, which is all about prevention. So it speaks to assessment of risks from health hazards in the workplace, providing advice on occupational health, safety and hygiene, ergonomics, and individual and collective protective equipment, surveillance of workers, which is extremely important if the objective is to prevent. So for instance, and we later on we'll see a very good example of how this is supposed to work. But basically it just means that the workplace needs to be more vigilant in ensuring that one isolated case does not become an outbreak. And so you'll have a system in place which is monitoring development. So persons in a particular space, workers in a particular space, one person gets ill, flu-like symptoms, headache, whatever the case is, another person. At some point, something should be there to trigger to say, this might be a sick building and we can do something to prevent this. And the recommendation on occupational safety and health speaks to eliminating hazards at their source in respect to, among the other hazards, lighting, ventilation, order and cleanliness, prevention of harmful physical or mental stress due to conditions of work, design, manufacture, supply, use, maintenance, and testing of PPE and protective clothing, as well as establishment of emergency plans and supervision of the health of workers. And all of this should factor into your safety and health management programs in your workplaces. And it's provided for in the OSH bill. All right, so I won't go too much into the others, just to mention that, for instance, the Violence and Harassment Convention, not directly related to occupational safety and health, but one of the experiences of persons during COVID is that if you're associated with an outbreak in terms of your workplace or even where you're from, your geographical location, then there's a level of discrimination and even cases of violence. And so in terms of the violence could have been, a matter of the public law, it's a public interest, a criminal matter if you experience violence as a result of any of those factors. But also within the workplace, there's the Violence and Harassment Convention, which speaks to the fact that violence and harassment occurring in the course of, linked with, or arising out of work, including when commuting to and from work, affects a person's psychological health and thereby is incompatible with decent work. And so in situations where persons in certain call centers, for instance, if there wasn't like a bus transportation organized by the employer, that was being done. And certainly with the nurses, they had an issue getting taxis, and their employer, which is the government, would have mitigated against that. And just before I leave this slide, the ILO Employment and Decent Work for Peace and Resilience recommendation, which enjoins governments to review, establish, re-establish, or reinforce labor legislation if necessary as part of initiatives geared at fostering recovery from crisis situations. Now, when we have crises, what businesses, the knee-jerk reaction is to try to save themselves, right, and to cut costs. And so the ILO is always trying to encourage workplace parties to take the high road and to see if jobs can be spared, which is why the social dialogue is so important in all of this. So practically, what can you do? The key is risk assessment. So decisions to open, close, and reopen workplaces and to suspend or scale down work activities should be made on the basis of a thorough risk assessment. Any strategy for a safe return to the workplace should be based on a hierarchy of controls, which we are gonna look at. It's just words now, but we'll soon look at that, which structures protective measures in order of most effective to the least. It needs to consider the entire working day to include commute to work and access to common areas. Should consider both specific job safety analyses as well as general safe work methods to include the level of risk for workers based on job functions and comorbidities, and be preceded by risk management, which would thereafter be periodic and include communication to and consultation with work parties. And that is from the policy brief from the ILO on the safe and healthy return to work. But we're gonna put some meaning to all of this. So a risk assessment is defined as a simple and careful examination of what in the workplace could cause harm to people. It enables a weighing up of whether enough precautions are in place and whether more should be done to prevent harm to those at risk, including workers and members of the public. It is a continual, ongoing process. It is not a snapshot of a workplace which can be likened to a workplace inspection. And so for this part of the presentation, I'm going to be guided by the ILO's 5-step guide to conducting risk assessments. Generally, risk assessments, there are two main types. You have a job safety analysis, which concentrates on specific tasks or jobs and look at the risks associated with carrying out that job and provide step-by-step details on the process to carry out the task. And so, for instance, with your office workers, a general job safety analysis would look at the various hazards with which you would interact in that space. So the focus usually is on the ergonomics, so your chair, the height of your chair relative to if you're using a keyboard, so you don't develop carpal tunnel, in terms of a line of vision with the computer, the other material that you're working with, and even cords in the office, lighting, ventilation. These are some of the things that you would pick up in a job safety analysis to just ensure that, you know, in moving from your chair to the printer, you don't trip over a cord and fall. So that's, in a nutshell, what that entails. And then for the construction industry, I have what is called a safe work method statement, which is the process of identifying hazards and assessing risk in the construction industry, from which is produced a step-by-step process for high-risk work. All right, so we're going to be looking at how to go about this risk management that we're seeing will assist us in keeping our workplaces safe. The first thing you have to do is identify the hazards. You're going to identify the hazards, and you're going to identify who may be harmed by this hazard and how. Then you're going to evaluate the risk and identify and decide on this, what control measures you want to put in place to mitigate against the risk. Then you're going to designate someone who is responsible for implementing whatever control measures and put in a time frame. And then you're going to also record the findings, monitor and review your risk assessment, and update when necessary. Because, I mean, whenever you introduce something new to the workplace, you have introduced a new hazard. So risk management is really an ongoing process. It's not just a one-off thing. So first, we're identifying the hazard. A hazard is the intrinsic property or potential of a product, process, or situation to cause harm, adverse health effects on someone, or damage to something, and includes psychosocial hazards, and includes a person's behavior where that behavior has the potential to cause death, injury, or illness to a person, whether or not that behavior results from physical or mental fatigue, drugs, alcohol, traumatic shock, and any other temporary condition that adversely affects a person's behavior. This definition is from the OSH bill. So for those persons who are concerned that the OSH bill might need some revision in light of COVID-19, the fact of the matter is that the basic provisions are there that would have helped us to have a ready response in that framework. So hazards can be one of 5 types. You have your physical hazards, chemical hazards, biological hazards, ergonomic hazards, psychosocial hazards. COVID-19 is largely a biological hazard, but it also creates situations where it can be a psychosocial hazard. And then also, because we are using a lot of chemicals now to clean, it can give rise to chemical hazards. And because people are working from home and they might not have the appropriate equipment at home, we can have ergonomic hazards. So it's really a mixed bag. So we need to be aware of all of them. So in terms of the chemical hazards, chemicals, if you're working with chemicals, then it can be absorbed through your skin. You can ingest it, you can inhale it. Physical agents such as noise, mechanical vibrations, extreme temperature. Biological agents, virus, bacteria, fungi. COVID-19, as I said before, is a virus, a pathogen. Ergonomic conditions, repetitive tasks, insufficient rest period. Psychological, where you have bullying, harassment, or job insecurity, or the job content is stressful. or certainly the experience during COVID-19 where I think in one of the words that I did, I mentioned it as the menacing probability of being a victim. I mean, that's a psychosocial hazard there because you're just stressed all the time, especially when there wasn't that much information and persons were just grappling with how to avoid this virus. The next step is to identify who may be harmed and how. And this will help us to ascertain the best way of managing the risk. And for this purpose, social dialogue is important. So management can't just sit in their office and say, okay, John Brown, but not Jane, but Mary. Because sometimes there are workers who, based on their individual risk factors, they're more prone. So because of their age, for instance, their disability, or pregnancy, someone is expectant, someone who is immunocompromised or have comorbidities. But in having that discussion, it's not about persons disclosing their medical status, because remember, there are those privacy considerations. And so one of the approaches that was taken in the Ministry with Responsibility for Labor and Social Security is to develop a life-threatening illness policy. And so at the end of the day, if you need any medical information to inform a decision such as this, then what would be required is for a doctor to say the person has a life-threatening illness. That can be one of several things. You know, we have to ensure that person's private information remains private. And then there's also the non-occupational factors, such as where you have a community spread. And of course, COVID then becomes a concern for everybody. So when you're looking at who may be affected, you have to also assess the exposure level. And to do that, you're going to evaluate the tasks and activities performed by workers and determine the exposure level associated with the task. There is a tool developed to assist with this. It's called an occupational safety pyramid, which you're going to be looking at. So at the lowest level of this pyramid, when you're looking at who may be harmed and how, you look at those who have minimal close contact with co-workers and the general public. So persons in remote work who generally work from home, or which is why part of the response was to have persons work from home, because that's how you really minimize the risk. Medium level is those workers who require frequent close contact with co-workers and the public. So school children, high population density work environments such as in the call centers. And we saw how that goes. High risk and very high risk are you're thinking about your frontline workers and your healthcare workers. But certainly when you have a community spread, even though your work situation may be low risk, but I mean, when you go out in the public, the risk might increase. And so you have what I refer to as a transitory risk. So for instance, you're a nurse, but you normally work in an office away from other persons, just checking temperatures and all of that. And then you're moved to another location, then the level of risk changes based on your job function. So that's something that employers need to be aware of, because when you're able to think about the level of risk, then you're able to have that discussion about how do we mitigate against this risk. All right, so the third aspect of our risk management process is evaluating the risk and identifying risk control measures. Risk is a combination of two functions: probability, which is the likelihood of the occurrence of a hazardous event or exposure, and severity. So how severe is it gonna happen, or how is it gonna be if it happens, and how likely is it to happen? And so the OSH bill defines risk as the likelihood or probability that a person will be harmed or experience severe health effects if exposed to a hazard, or that property will be damaged or lost. So the objective of identifying the risk is to minimize the risk, recognizing that there will always be a level of risk. Another tool which is useful in this regard is the hierarchy of controls. Now, based on this hierarchy, you have 5 tiers. The ideal outcome is to eliminate the hazard, which is not always possible. It is easier to eliminate a hazard, for instance, with a physical hazard at the design phase. But when you're interacting, I mean, there isn't much that you can do. So what you have to do is to minimize the risk. You do that by substitution, where you replace the hazard, engineering controls, where you isolate people from the hazard, administrative controls, where you change the way people work, how they interact with that hazard to minimize the risk. And the last measure, the lowest measure, is personal protective equipment. Now, when confronted with a hazard and there's a level of risk, a high level of risk, the first thing people tend to do is to try to go to the personal protective equipment. But maybe there's a way of getting rid of that hazard, and that should be explored first. In terms of COVID-19 and managing the risk, elimination, which we said is what you're to aim for, the ultimate response, but there's no pharmaceutical interventions for COVID. There's no vaccine for COVID, and that is the surest way, but you can eliminate the sources of infection. And remember, people are who are carrying the virus. So the literature is saying that you can postpone certain procedures, medical procedures, for confirmed or suspected cases. So if someone is suspected to have infection and they're supposed to do surgery, then that can be postponed, because that procedure would create a very high-risk situation. Or you can deny healthcare facility entry for visitors of confirmed or suspected cases, and which is why initially, when you were following the stories, you'll see that, especially in the US, where persons will drop off a loved one at the hospital and not be able to see them, because you're trying to minimize that risk, because that person might be a carrier of the virus, and you're trying to eliminate the source of infection. Also minimizing outpatient and emergency department visits for confirmed or suspected cases, which is part of why the ministry would have implemented telemedicine facilities, which is an administrative control, really, and also keeping personnel who are ill at home to reduce transmission. Then there's substitution. How does substitution work with COVID-19? So we can substitute COVID-19 for the regular flu, right? As opposed to if you were dealing with a physical hazard, you can say, okay, this is sharp, we're gonna replace it with something less sharp. That is not possible with COVID-19, but the learning coming out of the ILO is that you can substitute new work practices for older ones to reduce the rate of transmission. So whereas in terms of how your business work is normally carried out, you have persons going to the central workplace, you can institute work from home, remote work, virtual meetings, and organizational controls such as physical distancing. Engineering controls, and I use the definition from the Ash Bill, which it is a physical control of any kind that is designed to eliminate or reduce a risk other than a system of work or procedure, which would have been an administrative control, or the use of personal protective equipment. Let's look at this some more. Engineering controls in terms of COVID-19, ensuring general ventilation and thorough environmental surface hygiene, installing partitions, example, windows, panels, shield to shield workers from respiratory droplets, installing hands-free soap, sanitizer, and water dispensers, and receptacles for garbage and linen to minimize environmental contact, as well as installing a drive-through window for customer service. A key administrative control, which we have had in our body of laws, enabled in our body of laws from 2014, is flexible work arrangements, which allows flexi-time work, telecommuting, compressed work week, part-time work with, with benefits. Any of these would have helped with the physical distancing objective. Now, and I know that based on the discussions I've heard, persons were challenged with, how to go about this. So the legislation was passed in a way that pretty much removed restrictions in the law. So there isn't like a go-to legislation where you'd see, okay, under Flexible Work Miscellaneous Provisions Act, you can do A, B, C, X, Y, and Z. And I would want to suggest that you could perhaps look at the policy paper which informed the legislation to give content as to what you can do. And that green paper, the white paper, will actually show you that what was contemplated in removing those restrictions from the related legislation was to facilitate these arrangements. And so it was always possible for there to be telecommuting, where you carry out work from somewhere other than your central workplace, and also the compressed work week, where you spend less time at work, so you can do your 40 hours over a shorter work period. So instead of doing 40 hours over 5 days, you can do it over a shorter period of time. If you work, for instance, 10 hours per day, you can do it in 4 days, right? Or flexi time, where if there's a time when the office is very congested, you're trying to, certain workers want to avoid that, then you can have them start at a later time when it's more conducive and physical distancing can be observed better. But administrative controls beyond that, any policies, rule, guidelines, supervision, training, housekeeping, maintenance of equipment, personal hygiene practices, and work practices that you can implement that informs behavior modification in a way that's conducive to preventing the spread. Also, any measures aimed at reducing employee exposure to hazards, which flexi time is a very good example of that. Other aspects of administrative controls: identify and isolate staff with known or suspected infection, provide psychological support, implement and ensure compliance with basic infection control procedures, hand and respiratory hygiene measures, cough etiquette, establish protocols for cleaning frequently touched surfaces such as elevator buttons, door handles, work surfaces and tools, and install hand wash stations, locate signage in appropriate language and reading level in areas to alert staff and visitors of the need for specific precautions, screening personnel and visitors for signs and symptoms of infection and responding appropriately if present, minimize entries to business premises and maintain visitor entry log. I see some entities doing the entry log. So for instance, you go to the entity to do business, they would take your name and your phone number. And the purpose of that is this: just in case there is an event, there's a case of COVID, and in terms of the contact tracing, it would be easier to locate the persons who might have been exposed. So these are very critical measures. Of course, you have telemedicine, discontinue non-essential travel, job-specific education and training on prevention, which is also very important, that workers know how it is that they can keep themselves safe to reduce the anxieties. All right, so we have here the poster child on how to do it right. Conduent, which is a call center in Montego Bay, sends home staff after workers' mom tests positive for COVID-19. And this is the kind of reaction that we want to encourage from our employers. If we're really serious about safety and health, sometimes you just have to swallow your spit, as Jamaicans would say, and just do the right thing, because here it is that this thing has been contained, it has been really arrested. So you send them home and let a certain period of time pass when you know that persons are not infected, and then they can resume work. And as I said, kudos, this is really what we want to see happening. This is excellent occupational health surveillance going on here. And we are learning, which is very encouraging. All right, so at the lowest level of our hierarchy of controls, we have personal protective equipment, defined in the OSH bill as any equipment or substance which is used or worn by a person to minimize risk to the person's safety and health, and any accessory or other addition which is designed to meet that objective. So we know the PPE, the gloves, the gowns, the face masks, respirators, eye protection, but PPE must be worn correctly. And if you look at the Ministry of Health and Wellness's COVID-19 workplace protocols, you'll see there's a whole section on mask etiquette. There's also been training, and if you go into some public health facilities, you see videos on donning and doffing of your PPE, which is very important, because wearing it is one thing, but then it's protecting you when you're wearing it, but when you're taking it off, you're to also ensure that you're not infecting yourself with anything that might have come in contact with the PPE. So that's very good. So number 4, we need to implement risk control measures. So yes, we have identified a hazard, we have evaluated, we have looked at who may be harmed and to what extent, how, and then we have looked at the risk. Now we have to implement the control measures. Right, so completing the risk assessment is important, but implementing it is what will eliminate or minimize hazards and reduce risk. And this goes without saying. So from a resourcing standpoint, your plan of action could be, you look at what you can implement, that's low budget, and then look to see, in time, but you set a specific time frame as to when you can implement the other measures. And finally, in terms of step 5 of our risk management process, you're to record the findings, monitor, review, and update. And as we said before, risk management is not a snapshot, it's not a one-off thing, and it's an ongoing process. And certainly whenever new hazards are introduced into the workplace, then you have to engage a risk management process to ensure that you have everything covered. All right, so how do we future-proof safety and health in Jamaica? Because we have mentioned before that the legal framework is very lacking and not very instructive. But there are things in place that is helping us to work safely and smartly in spite of COVID. But what else can be done? And for that part of the discussion, I'm going to be looking at some provisions from the Occupational Safety and Health Bill, and to show how it is that the response can be shored up. The first thing I want to look at is the concept of a person conducting a business or undertaking. Now, traditional labor regulation looks at, is concerned with the employment relationship, which is the relationship between an employer and an employee. And so typically the employee is defined in contradistinction to an independent contractor, with which labor law is not concerned. And so, for instance, under the Factories Act, as I mentioned, it deals with an employment relationship, but the world of work is far more nuanced than that. And certainly a lot of people who are working are not employees, so to speak, right? You have a lot of contractors, you have volunteers, for instance. So how do we ensure that these persons who are doing work to benefit an undertaking our business are protected? So one of the approaches taken by this legislation, this proposed legislation, is to introduce the concept of a person conducting a business or undertaking. By definition, a person conducts a business or undertaking, whether alone or with others, whether or not for profit or gain, and pertains to the employment or engagement of a domestic worker in a dwelling house. Now, the main, approach is to take us out of the employment relationship. And one way to do that is to broaden this concept of an employer. Because if you have an employer, it must be an employee, right? But then if you're a contractor, then the person you're working for isn't strictly speaking your employer. So you use this term of art, this concept, so that we can broaden our understanding of workplace parties to respond appropriately and effectively to what is really going on in terms of the population of the world of work. So you put that now against the definition of a worker. As I said before, the employment relationship is concerned with the employer and the employee. The concept of a person conducting a business or undertaking, the PCBU, replaces the concept of an employer. And I didn't mention that the business you're looking at, so the PCBU can be a natural person or it can be a business. And then we introduced the concept of an undertaking was introduced to cover those work relationships that is not premised on a business. So for instance, when you employ a domestic worker, you are not conducting a business. This is your private household and you want domestic help. And so you're still the employer of that person. So when you, in terms of the concept of a person conducting a business or undertaking, you would not be covered by the business side of that concept, but the undertaking. So you're in your domestic sphere, that's an undertaking for which you have employed a domestic worker. You can ask me more questions on that in the question and answer, if I haven't been clear enough. All right, so the employee definition, somebody employed under a contract or service, was not sufficient to cover the full gamut of typologies of ways of engaging labor. And so the definition was wide. Now, in some of the laws, there's reference to the concept of a worker. But the concept of a worker is much wider than our understanding of who an employee is. And so under the bill, the concept is being used to the fullest extent possible in order to capture all those persons that would be in some kind of employment, operating in an employment context, albeit not the employment relationship. So the definition under the proposed legislation is a worker means a person who carries out work in any capacity for a PCBU, including work as an employee, and that's where the employment relationship would stop. That is where the application of traditional labor regulation would stop. But as I was saying to you, there's a need to broaden that scope. So it says employee, contractor, or subcontractor, an employee of a contractor or subcontractor, a person who is hired as part of a labor hire arrangement, which is very interesting, where pretty much there's a middle person. And so when John has work to be done and he needs workers, he would go to this middle person who would have like a pool of skill sets and make workers available. Now that worker doesn't sign a contract with John or Joe, right? But they made their services available. So if you're going to use the traditional understanding, then this worker isn't owned by nobody. And so when they fall in a pit, God forbid, nobody's going to be responsible, because they're going to say, they didn't sign a contract with me. Now, the thinking and the policy behind this is that the implications, the possible implications for the worker in terms of a safety and health breakdown is too serious, too grave for us not to put something in place where somebody can be held accountable, especially where the ability to mitigate against it is usually lies in, the financial capability, perhaps, of the person who has taken on this person to do work. So pretty much, if you have the benefit of somebody's labor, then you should also have the burden of protecting them, regardless of what you call them. So it also applies to an apprentice or a trainee, a student gaining work experience, a volunteer, a public officer, and a prescribed person. All right, so at common law, we mentioned that the employer has a duty to take reasonable care for the safety of workers. Under Convention 155, there was mention of the duty to take care so far as reasonable practicable. So under the OSH legislation, the OSH is trying to improve on what obtains at the common law, and also to set a bar that is consistent with the international norms of reasonable practicable. So the statement of the law is that a PCBU shall ensure, so far as is reasonable practicable, the safety and health of workers employed or engaged or caused to be employed or engaged by the person while the workers are working the business are undertaking. Also, workers whose activities in carried out work are influenced or directed by the PCBU while they're at work. Other persons, meaning like visitors to the workplace or clients, are not put at risk from work carried out as part of the business or undertaking. So what is this reasonable practicable, which is the standard of the duty? Reasonable practicable in relation to a duty to safety and health means that which is or was at a particular time reasonably able to be done in relation to ensuring safety and health, taking into account and weighing up all relevant matters, including the likelihood of the hazard or the risk concern occurring, the degree of harm that might result from the hazard or risk, and what the person concerned knows or ought reasonable to know about hazard or risk, ways of eliminating or minimizing the risk, the availability and suitability of ways to eliminate or minimize the risk, and after assessing the extent of the risk and the available ways of eliminating or minimizing the risk, including whether the cost is grossly disproportionate to the risk. So I say all of this to say, this whole risk assessment and risk management that we went through prior is built into the scheme of the safety and health legislation. And what it is saying is that as a PCBU, as someone who is going to have people do work for you, you yourself have a duty to know what risks are associated with doing this job. It means that you have to do your own job safety analysis and inform yourself, and not just inform yourself as to identifying the hazard, looking at who might be affected and how, looking at the risk, but also implementing the control. So you're looking at ways to eliminate or minimize the risk, right? And so that whole risk management rubric is built into the scheme of the legislation. Also, it balances the whole equation by saying, yeah, the cost is relevant, but after you have weighed up all of these factors as to the impact of this hazard, the likely impact. The proposed legislation also recognizes that you can have more than one PCBUs in any given situation. And so it says that where we have more than one person, then each person maintain their duty, which shall be discharged to the extent of their capacity to influence and control the matter, or would have had the capacity but for an agreement or arrangement purporting to limit or remove that capacity. So really it's saying that, you know, if you have a duty under the law, you can't contract out of it. So you cannot enter into a contract with somebody to say, I need some workers to do this job, and then you put in the fine print that I'm not responsible for their health and safety. No, the law would not. The bill, the scheme of the bill as proposed would not allow for that. And this would be perhaps my final slide, where we're looking at the business case for occupational safety and health, because there has been this concern that, you know, perhaps we haven't really taken the steps that we need to take because businesses are looking at the cost. They're doing their cost benefit analysis and saying, well, you know, it's gonna cost too much. But here this is saying that the cost, it costs you more to not mitigate against the risk. And so whereas the worker will suffer severely, I mean, you can be maimed, you can have long-term health conditions as a result of which you can't work, you know, but for the employer, you stand the risk of losing, where persons have to stop working due to an accident, or your best worker, your foreman, as they would call it on the side, is injured and has to be replaced, or a new worker has to be trained, you know? So there are so many ways in which businesses will benefit from having safety and health, occupational health management systems in place. And so, I know I kind of rushed through it. I hope I wasn't talking too fast and you couldn't hear. But at the end of the day, managing the risk, there's assistance in terms of the protocol and the workplace protocols to assist us, but also to have legislation in place would really future-proof us in terms of ensuring business continuity as a part of our business continuity plans. And the resources that I refer to are also listed for you to read, to be edified. So thank you for listening to me. And if you have any questions, please let me know.
Thank you.
You're most welcome.
Well, thank you so much, Catherine. In fact, we are giving you your own visa. You have permission to come and live in Montego Bay, having used Conduent as one of the examples. We are extremely proud because that's one of our members. Conduent is they're members of the Montego Bay Chamber of Commerce. And the fact that they were able to send home their staff, close their business for a day to ensure there was not a spread of COVID-19, we want to congratulate them, and to find that you use that in your presentation this morning, it feels good. We've been getting questions, and I want to, because I'm hosting this, I believe that I should have preference. So I'm going to ask you the first two questions. How does that sound? I think you should unmute.
Yes, that sounds good.
Right. The question I have is, what employers puts in place safety measures, such as providing PPEs for their employees? However, despite all of that, there's a spread of COVID-19 amongst their employees. Can that employer be held responsible?
Well, yes, responsible to an extent, because remember, the employer has a duty to take reasonable care. So if it is that, something happens and it becomes actionable, this employer is sued for negligence and for their breach of the duty of care, the court is going to look to see what could have been done and what has been done. And then an assessment will have to be made as to whether enough was done to absolve the employer of liability. Because remember, even though the employer has that duty of care, the worker also always has a duty to mitigate and to protect themselves. And so it depends on the level of evidence adduced. Suppose it's a worker who, okay, while they're in the space, they are complying because they are at work, but generally they are reckless and not following, and there's evidence of that, then there might be liability, but it might be apportioned to say you were contributory negligent, and so even though we're gonna say there is this level of responsibility, it might be a case where, in terms of your compensation, it is so nominal. It's probably a Pyrrhic victory based on the extent to which the employer went and the extent to which the employee did not back that up with personal responsibility. So
the responsibility then is for employees to ensure that they adhere to the rules and regulations, and for the employers to ensure the safety of their employees. Right. All right, my next question, and I want to invite those who are watching to use the comment section to send your questions as well. The other question, and this is quite interesting because I hear a lot of people saying that they have gone over 65, but they still want to work. Many people are 65, and 65 is not old anymore. 65 years young. So the government has ordered persons over 65 years old to stay home. What if you have an employee over 65 who insists on coming to work? Is the employer required to put in additional safety measures for these persons? Or should they get them to sign some type of form that allows them to protect themselves? The employer, that is.
All right, so the question is not that simple, because the fact of the matter is that if someone at 65 insists on coming to work, even though there's a safety risk, a health risk, maybe something else is happening. Maybe it's just a psychological thing of, all the days of your life you're just used to being out, and work is like a social space for you. And so to be at home, psychologically it's affecting you. So the intervention can be multifaceted, not just to just keep you out and say the government say you must stay out, but perhaps, there are social resources that we can make contact with for that person in terms of support systems. Because nobody in their right mind would want to put their health at risk. That's the point I'm making. So perhaps the issue is not just, wanting to come out of work. Maybe there's something psychological. Older persons sometimes suffer from loneliness. So,
I said that let me just make it clear. I did say that 65s don't think that them old anymore. Remember that a lot of these people want to come back because they can't afford to stay home. But continue.
Yes, but I would say, insist on it. If government say, then do it. You understand? So you don't have that person sign something to say, I'm not responsible. You ensure that whatever you assign them to do, maybe they need to have a continued source of income, is something that they can reasonably do from home, and you insist on it. Because if the government is saying this, remember, it's not just their health that is at risk, because they are more susceptible because of whatever underlying conditions they might have, but also the implications for your other workers that you also have a duty to. So you have to be balancing that. So you have to insist on it.
So you're saying don't feel sorry for the person who is 65 and allow that to get the better of you as an employer.
I said feel sorry for them and sympathize, but do the right thing.
All right, we have a question from a viewer, Sabrina Cross. She's asking, how do we address occupational safety and health in the workplace from home situation? In essence, right? How do employers discharge any potential duty?
From the home situation?
Mm-hmm.
All right, that's a very good question. One that I've been grappling with. To my mind,
you've been grappling with this? Okay.
I have reason to think about it. So a common law, the duty is to take reasonable care, and a part of that duty is to ensure a safe place of work and equipment and plant. Now, when the person is working from home, that's their private domain, right? So you don't have direct control, but in my mind, you still have operational control. And so, for instance, the worker is taking home your work to do. You have a discussion with them. You can't just ask for entry to their home to see where they're working from. But say, for instance, it's a long, tall Sally, very tall people who need a particular desk at a certain height and all of those things, and they normally have that at work. Engage the worker in a conversation. So you're going home, how you plan to do this? From a dining table? Okay, and you just say, well, you had that issue before, you might have that issue, and see how you can accommodate the worker. Because at the end of the day, they're still carrying out your job. And you still have a duty to ensure their safety. It's just that the extent to which you're able to fulfill that duty might be changed, but it still exists to an extent. So you at least have to have that discussion. But under the proposed legislation, it is much, much clearer that based on the definition of a workplace, that the workplace can be the worker's domestic residence. And as a matter of fact, the Australian authorities from which the legislation has its basis was very clear in their COVID-19 guidelines that yes, the workplace, the domestic space as a workplace was actually covered by that definition. And so any duty that the employer had, operationally, they still have that duty in terms of the worker carrying out the work from home.
Thank you very much. I've always had interest in that. So I really appreciate that myself. Thank you, Sabrina Cross, for asking that question. Next question is from Carlene May of Billy Craig. And she's asking, how do employers ensure a safe place of work if employees are working remotely? Is there still a duty to provide a safe place of work in that context? In a sense, this question is similar to the question that was asked before. So I don't know if you want to elaborate on what you had said before, or you want me to repeat this one?
No. It's quite similar to the question that Ms. Cross asked. Quite similar. So when the worker is working remotely, however, we're talking about not just working from the home space. It can be anywhere, like an internet cafe. Definitely the employer doesn't have any control over that. But to the extent that the work might be facilitated by equipment which the employer provides, then the employer has to ensure that equipment is safe. But you cannot, you cannot really stretch the principles to make somebody have a duty or a responsibility in a situation that they have absolutely no control over. Right? So it would really come down to there's circumstances alter cases. So every situation will be nuanced, so we'll definitely have to look at that. But as I said before, if the worker is not working from home, then you have to engage the worker in a discussion as to how it is that the work can be carried out safely. You're not necessarily gonna go to their home and walk around and look and inspect, but see what it is, what might be the concerns. Because at the end of the day, somebody working from home, they never even thought of it. But when they develop an issue, you know, some kind of medical concern, it's gonna come back to you. So it's best you have that.
You're saying that the employer should go to the employee's home and investigate? Oh.
No, I'm saying no. It doesn't allow for that. It's their private domain.
It does not allow for that.
So you should have a discussion. There are different ways of finding out what is happening. One way is to go and see for yourself, and the other way is to have a discussion with the worker to see what are their concerns in terms of carrying out the job safely. And certainly if it is that you're going to be making equipment available to the worker to carry out work, you have to ensure that equipment is safe.
All right, because you know, we have thousands of persons in Western Jamaica who work in the BPO sector, for instance. And during COVID, many of them had to go home to work from home. We have another question. So it's good that we're able to get an idea of how to deal with that case. We have another question coming from Joel Ryan. And he's asking, for building contractors that carry out maintenance and renovations on private and public property, is the duty of care shared by the employer, client, or is it the sole responsibility of the contractor? Very good question, I would say.
All right, so let me just understand what is happening. So I work with John, and John sent me to X site to work. So who is responsible for my safety?
Yes, it is the contractor. It's a construction site. I'm thinking he's a building contractor and he's carrying out maintenance and renovation work on a private or a public property. So is it the duty of care shared? Is the duty of care shared by the employer or the client?
All right, so
or is it the sole responsibility of the client? So is it by both of them or an individual?
All right, so what currently obtains is that, all right, so the person who employs you has that duty to take reasonable care for your safety. And the person whose property you're working from, if you're injured there, your action against them would be for occupier's liability, right? So that's what would obtain. But under the proposed dispensation, what you'll find is that both of them are persons conducting a business or undertaking. So the person who employs you would be the PCBU, person conducting a business or undertaking, simpliciter, right? So this is the person we directly work with. But then the person whose premises that you have gone to is the PCBU MC. So the person conducting a business or undertaking with management and control. You understand? So that person has management and control of where you're going to be working on. The point is this: the PCBU concept under the proposed regime would cover somebody who has an obligation to you as an employer, so to speak, and also the principle of occupier's liability. So that's how the person conducting business or undertaking with management and control comes into being. They have not employed you, but they have control over something that impacts on your safety at work.
Right.
You just put all of them under one concept, but then you disaggregate them in terms of the simpliciter, who has management and control. And remember, you have a whole list under the proposed legislation. It's talking about persons who design and supply and install. Because you recognize that if you look at the big picture, there are a lot of players who impact on the workers' experience of safety at work. And so you bring all of them into the picture under occupational safety and health. So to answer his question, currently, the person who employs him owes him that duty of care to take reasonable care for his safety. But if he's going to a third-party premises over which his employer doesn't have control, then that third party has a duty of care to him in terms of occupier's liability. So once he's there with permission, a lawful visitor to the premises, then they have a duty to ensure his safety while he's there.
Wow. This is my final question to you because we're almost at 12:30.
Wow.
Yes, can you imagine? Having spent a fantastic morning going into the afternoon with a very educational presentation from you, we plan to send this out to our members, all those who have registered the presentation itself. So persons will be aware. In the event someone signed on late as well, they'll get an idea of what you said in the beginning. Why is it taking so long for this legislation to come into effect? I'm curious about that. You have
Well,
any idea?
I'm not in a position to say definitively, but what I do know, and the last slide actually is indicative of what is going on in my mind. So when you're passing labor legislation, you need a tripartite to agree on the way forward. So you need the government, you need the workers and their representatives, and you need the employers and their representatives. What you find sometimes is that, especially because occupational safety and health and implementing control will mean outlay of capital, sometimes there's resistance on the part of business interests in the fact, based on the fact that they perceive that this is going to be an expense to them. And so there's that level of resistance. So that could be one possibility. But the possibilities are endless.
I was about to tell you that the possibilities are endless. That's a great note to end on. I want to thank you and the team at Dunncox, as well as the team at the UWI Mona Western Jamaica campus, and the team from the Montego Bay Chamber of Commerce and Industry, led by Paulette Neal, who is a young director who also works at Dunncox. She's an attorney. The VPs who have contributed to this, Carleen May and Damian Monthrow, our directors, Mary Chambers, Karen Benjamin. I just want to thank all the people who came on today as well and participated in this very critical webinar. The man behind the scenes hardly ever sees photograph appearing or see him online while we're doing these things. Mr. Andre Hewitt at UWI Mona and Mr. Patrick Prendergast at UWI Mona Western Jamaica campus. Thank you all for making it happen. Our next webinar is next Thursday, and that's the 9th of July. And on the 16th of July, and we want to invite you all back. We have over 500 people have registered already, so we want to have 1,000 people in the room. So we're inviting you all next week, same time, 11 a.m. The people in Kingston will be at UWI, while we will be right here in Montego Bay working with you to ensure that your businesses are covered. Just like the insurance companies would tell you about coverage, that's what we at the Montego Bay Chamber of Commerce and Industry is offering at this time. We want to ensure that our members are able to come out of COVID in a way that they'll be able to sustain themselves and that their recovery will not be as long as being predicted. Would you like to say anything before you go, Kadria?
Thank you for giving me the platform again. I would just like to say to your constituents that there is a bill which has been tabled before the Parliament, and it's being considered by the Joint Select Committee. I'm just going to encourage them to be a part of the process, to educate yourselves, to not just resist it and form some kind of opinion without really getting into it, because the matter of safety and health is very important. And if we're going to be meeting our development goals as a country, this is one legislation that we need to have in place. So get involved, get involved, get involved. And thank you.
Thank you. It has been a pleasure. Thank you, Andre. I don't know if you're hearing us, but thank you.